क्या है? रेटिनल डिटैचमेंट मतलब कि रेटिनल पिगमेंट एपिथेलियम का सेपरेशन न्यूरोसेंसरी लेयर से बिकॉज ऑफ एक्यूमुलेशन ऑफ फ्लूइड इन द सब रेटिनल स्पेस. What are the investigation to perform indirect ophthalmoscopy, B scan, and OCT? What are the types of the retinal detachment? Primarily include the Rhegmatogenous retinal detachment, Rhegmatogenous retinal detachment, and secondary Tractional retinal detachment and Exudative retinal detachment. The most common type of the retinal detachment is Rhegmatogenous retinal detachment. And what is the meaning of the Rhegmatogenous? The Rhegmatogenous means the Rhegma means tear, and the retinal detachment is tear in the retina. And the tear is it's a full tear, all 9 layers of neurosensory. Let's understand the pathophysiology behind this. The vitreous liquefaction started due to n number of causes. When there is a vitreous liquefaction, there is a posterior vitreous detachment, and this adherent part of vitreous exert a traction force on retinal layer. For example, this is the eyeball, the vitreous is detaching here, and here is the vitreous adherent. In this part will exert traction on the retina, which called complete tear in the all 9 layer of neurosensory, which called accumulation of fluid and in subretinal space. How patient will come to you in the OPD? He will complain of photopsia. Photopsia means that the on and off phenomena of light. He will say that the light comes and sparks suddenly and go out. It is due to the stretching of the nerve fiber of the optic X. And that he will complain of floaters because of the vitreous degeneration. There will opacities which will seen as floaters. Obviously, loss of visual field because of retinal detachment, a falling curtain, and the painless and loss of vision. What are the causes for the Rhegmatogenous retinal detachment? First is the pathological myopia. In the pathological myopia, the size of the eyeball will increase. There will be stretching in the layer of retina. There will be vitreous degeneration, blunt trauma, again vitreous degeneration, complicated cataract surgery where there is a small trauma to the vitreous which will lead to the vitreous liquefaction and the lattice degeneration of the retina. What are the signs that you will observe? In the acute case, there will be retinal detachment, and the retinal detachment will be seen as a gray color, and it will extend up to the ora serrata. The tobacco dust sign or the first sign of the pigmented, this pigment coming from the pigmented retinal epithelium. In the chronic cases, you will see, and in the acute case, you will also see the RAPD, the relative afferent pupillary dilation. What happens if you flash the light on the affected eye? Both pupil will dilate, but instead of constriction, when you are putting light, the both pupil are getting dilated. Then the chronic sign, there is an intraretinal cyst. In the OCT, you will see that some small cysts are formed within the retina and the retinal atrophy, and there is a subretinal demarcation line known as the high water mark for more than 3 months. What is the treatment? The treatment includes the photocoagulation based on the whether retina is still mobile or it is fixed. Why will fix to fibrosis? The treatment is a vitrectomy plus subretinal fluid drainage. That is the main problem. If the retina is mobile, we will inject some gases. We will push this vitreous to the retina, and this separation will be closed. And this is a silicone gel will be placed, which you have to remove after 12 weeks. It is from internal, from what you are doing from inside of the eye. Externally, you will put a band over sclera, where we will compress this layer, and the retinal pigment epithelium will come closer to the neurosensory layer. And the other two are tractional and the exudative. In the tractional, there is a cause. The cause includes most common diabetic retinopathy and the ROP, sickle cell retinopathy, which show the Roth sign. In the Roth sign, there is a hemorrhagic circle with the empty space. There will be no floaters, photopsia, and gradual loss of vision will be there. Instead of painless and loss of vision, you will see gradual painless loss of vision. The shape of the retinal detachment will be concave, but in the case of exudative and the Rhegmatogenous, you will see the shape of the retinal detachment as convex. The most common cause for the exudative retinal detachment is the choroidal melanoma, toxemia or pregnancy-HELP syndrome, and Coats disease. The sudden painless loss of vision will be there, just like Rhegmatogenous. The shape of the retinal detachment is convex. Hallmark for the exudative retinal detachment is the shifting fluid with the shifting of head position.